Um, so for our population profile assignment, we were assigned persons with a physical and/or cognitive impairment. The partners in our group are myself, Jasmine, Natasha, Hannah, Shannon, and Emmeline, and we are putting this project together. So to go over the unifying and typical characteristics of persons with cognitive and physical impairments, honestly, there are no specific criteria for any sort of physical or cognitive impairment in terms of this impairment only affects these type of people, this specific age. And I posted this photo showing that there is a vast variety of different types of impairments, including cognitive, visual, auditory, motor, and speech. We were just assigned the cognitive and physical impairments there. What I did want to add on to this is sometimes certain things such as vitamins or minerals can affect somebody's health, which I believe Emmeline will be discussing later on, different things as well. Going into cognitive impairment specifically, there are many different ways that we can detect them. Sometimes your friends might notice, your families might notice, maybe even a teacher over time might see something if it's developing. Other times things can be present at birth, such as maybe Down syndrome and other kind of little things like that. There are degenerative things such as Alzheimer's, dementia as well that can develop over time, and it's a multifactorial process for both different types of cognitive impairments. There are predilections are observable for certain groups. So for example, generally older adults will get Alzheimer's, not necessarily a 4 or 5-year-old. Usually Down syndrome does happen at birth. So there are some separate things that can happen there. There's generally no predilection towards gender for certain types of cognitive impairments. There hasn't really been extensive crazy research into that. And depending on what type of cognitive impairment, let's say we're discussing Alzheimer's, for example, certain things might need to be retaught. For example, writing, reading, shapes, numbers, depending on the severity of the Alzheimer's, dementia, etc. And a diagnosis can only be made after testing is completed. You cannot say you have Alzheimer's, for example, when you haven't been clinically diagnosed by a doctor. I have posted a representation here of the Montreal Cognitive Assessment to the right of the screen. And it's essentially what they'll go through. They'll ask a person who is suspected of having dementia, Alzheimer's, and they will score it based on what they've written in the assessment. So moving on to physical impairments, they can be congenital, degenerative, accidental, idiopathic, or iatrogenic. So accidental, for example, could be a accident at work. Somebody might not have been on a safety harness, or they weren't wearing their proper PPE and something got in their eye, let's say. Idiopathic is of unknown origin, so you never know what might happen through life, so you can never say never for anything. An iatrogenic, for example, could occur during a surgery. So let's say somebody is trying to repair something in the spinal cord and something goes wrong during the surgery, that can cause somebody to be physically impaired, such as paraplegic or quadriplegic. There are no predilections towards gender or age. However, the mental state of men tend to get them into more trouble at work during like construction, stuff like that. Sometimes they're like, oh, that'll never happen to me. But, like I said, you can never say never for certain things. It could happen due to lack of safety education, or they know and they just don't care, whatever the case may be. Just gotta be careful. And some skills may need to be retaught if the person was not born with the impairment. So let's say walking after an amputation, or somebody maybe had gotten a chemical in their eye later in life and it caused them to go blind or even partially blind. They're going to have to relearn a lot of stuff. I mean, you can't really drive, you can't do certain things. So there's a lot to take into account there, but I'll let my team members talk a bit more about all these things. And I'm just going to pass it off to Emmeline.
Thank you, Jasmine. So as you know, there are 12 determinants of health that have been identified by the Public Health Agency of Canada. This determinant of health includes socioeconomic factors and other variables that affect all groups of population in some degrees. For the target population we are analyzing in this assignment, we found that their health is directly related and even compromised by many of these determinants of health. However, some of these determinants will have a greater impact on this specific group than others. The first group of determinant of health we are going to explain includes income and social status, employment and working conditions. Many research states that there is a correlation between income, social status, and health. This means that people with a higher socioeconomic status tend to have better health. Considering that people with physical and cognitive impairment have less opportunity to get to access jobs related to their disability, they are affected by this determinant of health in more degree. In other words, it's more probable that they could have a lower economic status, which redounds in many aspects of their health and life quality. When we analyze education and literacy as a determinant of health, it is important to consider that persons with physical or cognitive impairment, dependent on each individual situation, could find it challenging to achieve a successful education. Therefore, a lower level of education means less employment opportunities. The other group of determinants of health involve the category of childhood experiences, physical environment, and biological and genetic endowment. Childhood experiences is a broad determinant of health category that includes the conception and prenatal aspect of life. There are other factors involved in this stage that have a significant implication in the development of a child and their future life. Factors could be physical, social, environmental, and also emotional. For children with physical and or cognitive impairment, these determinants of health could have a bidirectional outcome. Not only could childhood experiences lead to a child ending up as a part of this target population, but it also can affect this group posterior cognitive development, inclusion in the society, and their health. Finally, we should mention the impact of social support and coping skills, healthy behaviors, and access to health services. It is essential for persons with physical and cognitive impairment to have an adequate social support system that they can count on, as well as having access to the appropriate health care services in order to make a big difference in their everyday life and their health. Now I'm going to allow Hannah to continue with the presentation. Thank you.
Thanks, Emmeline. So my topic today is going to be the oral health related issues for those with cognitive or physical impairments. They may have possible difficulty with their oral self-care, so they might not have enough dexterity to floss if their impairment affects the use of their hands. They may also be unable to process the need for oral self-care and keeping it clean and why you need to, depending on their impairment as well. So they may also have lack of access to transportation for their dental visits, or they may have difficulty traveling to an office or even getting outside of the house without someone to help them, which leads me on to my next point, lack of access to someone to help them, or a caregiver who can help them meet those oral self-care needs or help them with other aspects of their life. That may be a challenge as well. So lack of access to adequate funds for dental care may be present in those with impairments. They may have minimal health insurance if they have any at all, or they may have lack of funds if they don't have health insurance, as many people with cognitive and physical impairments are unable to work due to their impairment. So we'll discuss the next topic. So the considerations for dental hygienists when treating those with physical and cognitive disabilities. You should not assume the client's disability or the capability of their impairments. You should consult directly with the client or their caregiver if the client is unable to communicate with you about their impairment. And that will determine what you know about their cognitive level. And as you go, you'll learn more about what their capabilities are and how they're able to interact with you and how you can be successful in completing care for them. So you should explain pieces of information clearly and one step at a time. Try to be fairly slow with your words, not too slow, but concise so that they can understand it, and make sure that they understand as well. Communicate with them after giving the instructions and see if they understand. So you should also plan lots of time for their dental hygiene appointments. You don't want the client to feel rushed, so giving them enough time to complete their care and give them the same care that you would anyone else is very important to build the rapport. So you should not move assistive equipment that they have, wheelchairs, canes, walkers, any aids that help them. You shouldn't move that without their permission. If they give you permission, you must notify them where they place their belongings. And during the appointment, you should plan a signal so that the client can let you know if they need to communicate anything to you. So putting the hand up if they're able to do that, or whatever they're capable of doing to communicate to you while you're treating them. So next topic is how the dental hygienist can assist clients with cognitive or physical impairments. So those with cognitive or physical impairments may struggle to maintain their own oral health, and they may require a caregiver or someone to assist them on doing daily tasks. So for example, like we mentioned before, they may have poor dexterity, and this can affect the client's ability to thoroughly clean their oral cavity. So the use of the following aids can be helpful with those who have cognitive or physical disabilities if they require this assistance. So a power toothbrush with a large grasp handle, or just a regular toothbrush with a large grasp handle if you are unable to access a power toothbrush. You can strap the toothbrush to their hand with a rubber band or using Velcro as well. And this can help them reach the hard to reach areas easier. And this may give them a sense of pride in being able to accurately clean their teeth. So if the client needs a caregiver's assistance to brush their teeth, the dental hygienist should also educate the caregiver on how to properly brush the client's teeth with the proper techniques and ensure that they can instruct this back to you after giving the education. So yeah, thank you. I'm going to pass this on to Natasha now.
Right. So interprofessional care occurs when multiple healthcare professionals combine their knowledge and skills together to achieve the highest level of care for the client. So a dental hygienist plays an important role in the healthcare team because many people see their dentist like 1 to 2 times a year, but might not see their doctor for several years, or vice versa. A doctor could send their clients to a hygienist or a dentist. So as hygienists, we must work within our scope of practice to deliver better individualized oral health care, oral health education, and other things to clients and their caregivers, as well as refer when it's indicated. So while a dental hygienist is trained to deal with many oral healthcare needs, regardless of the client's abilities, the involvement of other healthcare professionals play a role in the health of these people is crucial. So the healthcare professionals that have been included in this presentation are primary care physicians, physical therapists, and occupational therapists. And while these healthcare workers play a vital role in improving the oral health and total health of every client, there are many more fields that also contribute to the interprofessional team. So primary care physician is also referred to as a family doctor, and they provide ongoing care that includes the diagnosis and treatment of conditions and diseases not requiring the care of a specialist, counseling, health promotion, and disease prevention, and primary and mental health care. This healthcare professional is important in achieving oral and overall health because they are usually able to build a relationship with the client because they provide care throughout their lifetime. So they see them more often than most other healthcare professionals. So they're usually the first person a client will turn to when a systemic problem arises, and physicians are able to observe for signs of cognitive impairments from an early age. This means that physicians will have a good understanding of any medications, conditions, and limitations the client may have and will be able to advise the dental hygienist on ways to proceed with care in the best way possible. A physical therapist plays a key role in the interprofessional collaboration because they are specialists in evaluating and treating disorders of the human body, primarily by physical means. By using exercise and different treatment styles, they work to improve the physical function of the body systems, as well as decreasing the amount of pain or discomfort the client may feel. Physical therapists can usually be a useful ally with the dental hygienist because they can help a client with physical disabilities regain the ability to perform oral hygiene tasks, to be able to eat proper foods, and they may even be helpful in aiding with the temporomandibular joint injuries. They are vital in aiding the clients in regaining their independence and preventing any further impairments. So an occupational therapist uses an approach to allow the client to participate in everyday activities. They are perhaps one of the most beneficial team members because they are working with the client in their homes on a regular basis. They assist with activities of daily living, such as feeding and personal care, in order to maintain their sense of control. This means that they are able to ensure the client is maintaining their oral health on a regular basis by reminding and assisting as needed, as well as ensuring the clients are receiving adequate and non-cariogenic diets that will further improve their oral and systemic health. So now I'm going to give it to Shannon to talk about the next topic.
So I'm going to talk about the dental hygienist's role in addressing the needs of population health. So the dental hygienists are one of the first lines of defense when it comes to addressing the needs of a population because they work in communities. Their role goes beyond cleaning teeth as they play an important role in disease prevention of not only oral health, but overall health as well. This holistic approach to healthcare will help to tend to a variety of health needs of each individual and populations. So how can the dental hygienist contribute to public health initiatives? Insurance companies evaluate data collected through health history, screening, and assessments whenever a claim is made. Insurance companies analyze this data to gain a better understanding of disease patterns and conditions to develop insight on how clients respond to treatment and interventions. This information helps to create public health interventions. The dental hygienist should be concerned with implementing highly accurate information in order to assist in public health initiatives. So this concludes our presentation. Thank you all so much for listening, and I hope that you've learned some new things that may help you on your journey to becoming a dental hygienist.